5th, Freud changed the Oedipus complex dramatically after in the 20s.
Mm-hmm.
Right. I don't expect you to answer all that, but
Okay, well, you may have to remind me.
Answer all five.
You may have to remind me. You may have to remind me. Going backwards from number 5, because my short-term memories not can work for that at least. He did obviously from the Hans case, where you have prototypical boy-mother Oedipal complex. It was expanded in all sorts of directions. Even people who defend the Oedipus complex say, some of those expansions are much shakier theoretically. It's very hard to make the female story work, so on and so forth. But leaving all that aside, the fact of the matter is you can go through and glean quotes from Freud's own work all the way to the end of his life stating this is the center of psychoanalytic theory as I see it, clinical psychoanalytic theory. So I don't think all the changes matter to the argument I'm making. That's number 1. Now, going backwards from there, do you remember number 4?
yes. The theory of science that you're presenting is...
When you say that, what do you mean by the theory of science?
That you make a hypothesis, that you test it, and then you show that the evidence is related to the testing of it. Freud didn't think that way.
I think Freud not only thought that way, he thought of that way in a rather extreme manner. He actually essentially takes the view that a hypothesis must be a universal. That's why some of his arguments are so odd to us. Well, there could be 20 different causes of anxiety neurosis. Freud thinks that you have to have a universal causal hypothesis for each of the phenomena in a class that you're explaining. He has a very classic view of science as lawful hypotheses, and he is willing to dismiss and ridicule his opponents who can't live up to that. So but I mean, the details of that don't matter. It's quite clear in his argument that he's very sophisticated as you or I, about the logic of science. Now, his testing and his actual decision as to whether the data confirm is another issue. But I would dispute that. I think Freud is absolutely brilliant and contemporary in his understanding. Look at his arguments about unconscious mentation. They have a modern essentialistic, he talks about electricity, that it's not the surface phenomena, it's the underlying essence that you're trying to get at through the evidence. And therefore, it may predict surprising things over here. He's totally contemporary in his philosophy of science. Number 3.
Number 3, the Olga. How do you know that she...
There have been interviews that have emerged in the Freud archives recently. I mentioned one of the articles I put up there is a detailed analysis of those Freud archives. Through those Freud archives and through the work, not only myself, but other people, we have been able to identify with high probability that a particular patient Freud describes in a letter of 1896 or something is no other than Olga Honig. We know that Freud mentions in the case that he treated her and that's how he came in contact with the family. In fact, Olga Honig is the one that introduced Max to Freud, and Max went to Freud, we find out in the interviews in the Freud archives. Max actually went to Freud for marriage advice, whether he should marry Olga. And a year after the marriage, when it was a disaster, he went to Freud for advice about whether he should try to save the marriage or get out of it. Freud consistently gave Max just the worst possible advice. And, marry her to save the relationship, have a child to save the marriage, and so on, all the things that we would laugh at today. But the point is, this relationship, although I may have imputed certain things based on my analyses, the basics of the relationship, historians, including myself and others, have more or less established at this point. Question 2?
Okay, we have one more question from
I'll talk to you later.
All right, so
Okay.
during the break, I encourage you to talk to Jerome further. Yes.
Well, actually, my question is to elaborate on what you're talking about just now, because as I understand it, Freud's theory would make certain predictions as far as the progress of symptoms in Hans. And you say the data doesn't support that. But the data comes from this little family drama in which everybody concerned has a conflict of interest. The father is the father in this Oedipal drama, also a former patient of Freud, very supportive of Freud, anxious, I assume, to help Freud in whatever theories he's postulating. And the mother is a former patient and hostile to Freud. Little Hans is in the middle of this and, probably picking up some of this drama.
Yeah.
And so this is a drama that Freud's using, and he's using this is a data that he's using, then it's suspicious from the start. So I don't think you should approach this as he misinterprets the data because the data is faulty to begin with.
Well, that doesn't quite follow. In other words, I mean, he makes claims based on this data. So we can look at whether those claims are correct. He says, oh, sexuality diminished after the symptoms. Is that correct from the data? Now, you can look at it. I mean, Freud is a very bad reader of the data. Sometimes he says things that in the diary from the father is contradicted 2 pages earlier. I mean, obviously he was a busy man. The point is, it's the best data we have, and let me just say this. Most of the cases we have are Freud's cases. We know from historical work that Freud rewrote those cases to make them, fit his theories better. This is unique, this case, because it is true Max Graf was a follower of Freud's, but Max Graf says that he, using shorthand, actually kept this diary as the interactions went on, or immediately afterwards wrote down literally what was happening. So it seems to me we do have a record that is at least the only record we have, other than the Schrader case, which is a book, which has nothing to do with, which the only record we have of the evidence independent of Freud working it over, and then Freud's interpretation of the evidence. So it seems to me to be particularly powerful evidence, actually. Now, it's true there was a family drama going on. The mother had almost nothing to do with the case. The father was the one that pursued it. The family drama can be independently analyzed, and that's the second book, Bedtime, which is the fight over how much Hans can come into the bed and cuddle with his mother, with the father using Oedipal theory to control her behavior. I see that as power, not as a theory. But the point is, the data is still there. It's the best data we have. If it doesn't confirm things, let's say we believe everything you've said, then Freud has not a leg to stand on. He's claiming he has a leg to stand on because of this data.
Okay, so if you have further questions, please, we have now 10 minutes, and this is we're going to have to be really rigorous about